fundamental driver of a hospital's performance is patient revenues. They've been dropping for years. And the question is, what's going to reverse that? The number one determinant of patient revenues is doctor referrals. And so we probably would agree on that. So doctor referrals drive whether or not someone goes to the hospital. You don't go there on your own generally, unless you're through an emergency room. You go there because your doctor sends you there. And in our marketplace, we have a lot of hospitals. And they're all newer, and they're all operated by a variety of systems, UH, Metro, and the clinic. So our doctors in our general region have very competitive choices. And frankly, many of those choices are better served by going to other places because of the investments that have made there. UH spent $100 million upgrading St. John's West Shore in the last several years. It changed that hospital from a small little community-based hospital to a major medical center. That significantly altered the demand patterns in places like Bay Village, Rocky River, Westlake, Fairview Park. Not so much Fairview Park, but North Olmsted, where those squads used to bring emergency folks to us. Now they take them to St. John's. That's not a clinic hospital. So it's not about the clinic nefariously diverting folks to St. John's. That's their arch rival. So the fact of the matter is we have a highly competitive market. We have technology that lessens demand for being in inpatients, and we're not going to be there very long. And the question was, where are we going to get more patients? We couldn't answer that question. We just couldn't do it. In fact, we looked at a world where there's going to be fewer of them, and we're going to have to compete for a smaller pool of inpatient care. And how are we going to do that? We'd have to make a big investment. It would be highly risky to make that investment. And whether it would pay off, who knows, and who would be willing to make that investment, $100 million. We couldn't figure out who would do it. It wouldn't make sense for most people, for anyone really. So I think what we're subtly hearing is somewhere, somehow, the taxpayers of Lakewood should take control of that hospital again. I got to tell you, you want to bankrupt a city? That's the surest way to do it, and nobody saw that as a viable future. So the fact is, when we realized we could not come up with more patients by any rational strategy that would be viable, is when I think I realized that this hospital could not be saved as an inpatient model, but it has to be saved as an outpatient delivery system. That's what we need, and that's what's proposed, and that's what we got to make sure we get. And it's got to be a good one.
Mr. Skindell, why do you feel that Lakewood Hospital can be saved, and how would you save it?
So the mayor has totally supported the created future created by the Cleveland Clinic, and he has totally disregarded and failed to oversee properly the contracts to ensure that Lakewood Hospital remains an ongoing concern. And that's one thing that you need to do. First, start with the contracts, because we have legal binding contracts to deal with. And as mayor, I would join the plaintiff's side in the lawsuit to enforce the contracts. We need to make sure that Cleveland Clinic stops wasting our hospital and stops redirecting the patients elsewhere. The mayor refuses to do that. The mayor says it's market forces, it's change of healthcare. It is change of healthcare. The Cleveland Clinic is building a new bed tower. They want that process to be successful. They don't. Lakewood Hospital is a stepchild to them. They don't want Lakewood Hospital to be successful. We can join with and search for other alternatives, and join with the independent doctors, and join with other hospital systems that are interested in keeping Lakewood Hospital alive. We don't need to have this created future of no hospital, loss of 1,400 jobs, huge loss of revenue to the city of Lakewood.
And then I ask if either one of you has a response to what the other one said.
Well, I think there is a fundamental difference. I think you've picked that up. I'm looking ahead at a market to be successful in both a demand for services from our citizens and a need, and how we can best serve that need. I do view the world through that lens. I'm not a lawyer. I don't believe in suing. I don't believe in auditing your way to success. I believe you invest in services that meet needs, that are clear and compelling, and that I think we have to figure a way to make that investment. I do think you have to a certain degree, create the future that you want. And you do that through investment, and you do that through intelligent bets on what you think that future is going to look like based on needs. I do view that world through that lens. And I think the proposal for Lakewood to protect our healthcare delivery has to consider those forces. No question about it.
The mayor misstates the cost to do the work at Lakewood Hospital. Again, Lakewood Hospital Association brought forward a plan in 2008 as mayor became a council person that's totally renovate Lakewood Hospital and build a new bed tower at $65 to $69 million. If you don't go with that new bed tower, but start converting beds into single beds and adding some basic technology, yeah, $100 million for the best of the best, but we don't necessarily need to be the best of the best in the technology there. If we do a good upgrade, and that would be satisfactory to the doctors to refer, we can do it at a significantly lower price tag. If you want to buy the Jaguar, you go with the mayor's plan. If you want to buy a Taurus, I'm willing to go for that. The key thing is to keep the health care in Lakewood. Huron Consulting Group, the city council's consultant, said our community, Lakewood Hospital, can support an inpatient hospital. And they put a plan together what city council should look at to do. City council is not going down that route right now. They decided to start negotiation with the Cleveland Clinic. My belief is I will utilize that Huron Consulting report and start moving forward to keep an inpatient hospital in the city of Lakewood.
And I'm going to give you Huron's correction of his statements from his campaign literature. He fails to say what Huron said, that the size of Lakewood, in fact, could support a hospital if you got all the business. So if you basically had no competition, well, that's not the world we're in. And that's what Huron, by the way, this is their response that I'm going to give you to what he is saying.